So chapter 8 is about appendicular system. If you remember, chapter 7 was axial skeleton. So appendicular skeleton is about the girdles and also the limbs. So this is the pectoral girdle, or the shoulder girdle. So there's two different bones here. One is the clavicle and the other one is the scapula. So the clavicle is the one that articulates with sternum, which is part of the axial skeleton, and also clavicle here it articulates with the scapula, and then the scapula articulates with the upper limb. So upper limb does not have any direct articulation with the axial skeleton. Clavicle is S-shaped bone. It has a medial end, and also it has a lateral end. The medial end is called sternal end because it articulates with the sternum, and it is sharper. And the lateral side is called the acromial end, is flatter, and it articulates with the acromion of the scapula. So this is a superior view, and you do not see a lot of bony markings. Not much is going on there because there's nothing attached here. In the inferior view, you can see a couple of bony marking. One is called costal tuberosity, and the other one is called the conite tubercle. So these are a couple of bony markings that is viewable only on the inferior, from the inferior side. Excuse me. So the other bone that is part of the pectoral girdle is scapula, and scapula is a triangular kind of bone. It has two surfaces. The anterior surface, this one, is called the subscapular fossa, and the subscapularis muscle attached here. And there is also on the other side, which I will show it to you in the next image. It has three borders. So this is the superior border, and the superior border ends here in the suprascapular notch. It has the medial border. This is toward the vertebral column, and the other one is called the lateral border, so toward the limbs. It also has three angles. So one is the superior angle, inferior angle, and the lateral angle, which is more important. And the lateral angle, you can see the glenoid cavity, and this is where the head of the humerus bone. Humerus bone is the bone that is in the arm, so it articulates here. Also, there is two other processes. One is called coracoid process, that is located anteriorly, and acromion, that is located posteriorly. But acromion is higher than the coracoid. So this is the posterior view, and it has two fossae. One is called the supraspinous fossa, and this is where supraspinatus muscle attaches. And this one is called infraspinous fossa, this whole area, and that is where infraspinatus muscle attaches. So the posterior surface is divided into these two fossae by this bony structure, which is called spine. And the spine continues laterally and then ends up with acromion. So again, you can see the acromion is higher than the coracoid. So if you touch your shoulder, the highest bony structure, or the feeling that you have, there is a hard area on your shoulder, that is the acromion. So this is the highest point. If you come a little bit anterior to that, then you will feel another hard area, and that is the coracoid process. And here is the glenoid cavity, so partially it's visible. That is where the head of the humerus attaches. Also the border, so this is the lateral border, which is more oblique. This is the medial border and the superior border, and here you can see it on the lateral side. it is there's a notch there, suprascapular notch. This is the lateral view. The most important structure is this one. This is the glenoid cavity. Once again, it head of the humerus articulates here. There's some bony prominence here, supraglenoid tubercle and infraglenoid tubercle. This is the anterior surface, which is the subscapular fossa, and this is the posterior surface. Posterior surface is separated by the spine into the supraspinous fossa and infraspinous fossa. Coracoid process is located anteriorly, and acromion is located posteriorly. The only bone that is located in the arm is called humerus. Not much humor in that. And when you are evaluating a long bone, you have to look at what is in the proximal part, what is in the distal part, what is in the anterior, what is in the posterior, what is medial, and what is the lateral part of the bone. So this is important, especially for your practical exam also, because these bones are just by themselves, so you do not see which is the proximal, which is the distal. The proximal is closer to the torso, and distal is farther away from the torso. So here, if you start here, this is the anterior view, and this is the proximal area. How do I know this is proximal? Because this is the head of the humerus, and the head is located medially. This is where it articulates with the glenoid cavity of scapula. And also there is a neck here in this area. This is a neck, and this is the anatomical neck, and there is also another one. This is called the surgical neck. Why surgical neck? Because humerus can fracture from this area a lot more. So not from this area, but it breaks from this area. You have two bony prominence here in the anterior view. You can see this is the greater tubercle, this is the lesser tubercle. In between there is a sulcus there, okay, and the sulcus is a groove, and this is called intertubercular sulcus because this is in between these two tubercles. So if I go back and I look at it, all these structures, you can see all of them are in the proximal view, all of them, okay. And the head of the humerus is located medially. This is medial. Greater tubercle is located laterally. Intertubercular sulcus and the lesser tubercle is they are viewable, they are visible only on the anterior view. The greater tubercle you can see partially in the posterior view, but you do not see intertubercular sulcus in the posterior view. Then is from this area to this area, this is the shaft. You can see the deltoid tuberosity, and this is where the deltoid muscle attaches. And this one is called radial groove. This is where radial nerve passes through. So the radial groove is located, posteriorly, and the deltoid tuberosity is located laterally. When we get to the distal part, there is a lot of different structures there. The one that is visible anteriorly and posteriorly together, this is called trochlea. Laterally, there is a round structure that is called capitulum. The capitulum is located laterally, but also visible anteriorly. You cannot see it in the posterior view. There is also some fossae here. There is two fossae anteriorly. This is called coronoid fossa. Coronoid fossa. And this is when you flex your elbow, the coronoid process. This is the coronoid process of ulna. This is a bone in the forearm. When you flex, this area comes to this area. This is the coronoid fossa of humerus. And when you flex your elbow, this coronoid process goes all the way here. So this is an impression of the coronoid process of the ulna. Lateral to that, you have the radial fossa. Okay, radial fossa is located distally in anterior view and above the capitulum. Okay, and that is an impression of the radial head. So when you flex your elbow, this is the radial head in the elbow that comes here, and this is why that impression is there. Another structure that you see, this is called the epicondyle. So epicondyle means above the condyle. Condyle is articular surface, usually half spherical. So this is above that. So this is the middle condyle, and that is the lateral condyle, medial condyle. If you look at the posterior view distally, you see one fossa there, and this is called olecranon fossa. And this is because of the impression of the olecranon process in the ulna. So this is the ulna, and this is the olecranon process. So when you extend your elbow, the olecranon process goes here in this area. So this is why you cannot extend your elbow more than 180 degrees, usually 180 degrees. But that is the impression of the olecranon process. So the bones of the forearm, there are two of them. Medially, this is called ulna, and laterally, this is the radius. Okay. Ulna, the bigger part of the ulna is located medially, but the bigger part of the radius is located distally. The head of the radius is located proximally. The head of the ulna is located distally. They are connected with each other by this regular connective tissue. This is called interosseous membrane. You can also see some other structures in the proximal and distal areas. So olecranon, you cannot see it from the anterior view. It's difficult to see. This is the olecranon of ulna. So if you touch your elbow from the posterior side, this area, this is the olecranon. This area, this is called trochlear notch. Okay, and this is where it articulates with trochlea. This is the trochlea of humerus. So this area goes to here, especially when you flex your elbow. This is the coronoid process of the ulna. This is the coronoid process. And as I said before, when you flex your elbow, then it goes here in the coronoid fossa of the humerus. This area is the radio-ulnar joint. So this is the proximal area. I'll come back to the radial notch. It's difficult to see it here. I will show it to you in a different image, okay? So this is the radial head proximal, then is the radial neck, and the radial tuberosity. This is where the biceps tendon muscle attach. Biceps tendon muscle attaches here. If I go distally, so the main structure that you see is called radial styloid process. So styloid, if you remember from chapter 6, it's a sharp bony marking. You see also ulnar styloid process here. So this is located medially. And here is the distal radio-ulnar joint. Distal radio-ulnar joint. I'll come back to this notch in the next image, okay? If you look at it posteriorly, the main one that you see, olecranon, is here. So this is the big one. You cannot see the trochlear notch here. You cannot see the coronoid process here. And these structures are located proximally. So styloid processes are located distally. These structures are located proximally. Head of the radius is located proximally, and the head of the ulna is located distally. Okay, so this is the proximal view of ulna. So side view. This is olecranon. This area is olecranon. So normally it's located posteriorly, and this is the trochlear notch where it articulates with trochlea of humerus. This is the coronoid process, and when you flex your elbow, that goes to the coronoid fossa of humerus. And this is the radial notch, which means it's an impression of the radial head. This is where the radial head articulates with ulna. So this is the radio-ulnar joint area in this area, but if you talk about just the bone itself, this is the notch. They call it radial notch because it is because of the head of the radius. It belongs to ulna, but it is called radial notch. Okay, so because of the radial head. And if you look distally here, you can see the radius is bigger than ulna. So this is the head of ulna. This is the distal part of the radius. This is the radial osteoid process located laterally. This is the ulnar osteoid process located medially. And this is the ulnar notch now. Okay, so this is depression in the radius, but that depression is because of the head of the ulna. Okay, so both of them together, that will make the radio-ulnar joint. So this is the radio-ulnar joint, but if you talk about this area only in the radius, that is called the ulnar notch because of the head of the ulna that making that depression. You also have some articular surfaces. So this is for the scaphoid, and this is for the lunate. These are the two bones in the wrist. These are the bones on the hands and the wrist. So this is the anterior view, and this is the posterior view. Anterior view is a little bit different than the posterior view. You can see there is 8 carpal bones here, but 7 carpal bones on the posterior view. Then this area, this is called metacarpals, and these are the phalanges. So metacarpals and phalanges. So there is 3 different parts in the wrist and the hands. Okay, so carpal, which are these bones, 8 of them, and metacarpals, which are 5 of them, and phalanges that are 14 of them, not 15, 14. So coming back here, it is my advice that you can learn it in 2 different rows, because these bones are located in 2 rows. So you can have it lateral to medial or medial to lateral, it does not matter, but learn it in 2 different rows. So this is in the proximal row, lateral to medial. This is lateral because this radius is located laterally, and also easy to remember, this is the thumb. So the thumb is anatomical position located laterally. So scaphoid, lunate, triquetrum, and pisiform. Okay, so this pisiform is the one that you can view it anteriorly, but you cannot view it posteriorly. You cannot see it here. So here again, scaphoid, this is lunate and triquetrum, but you cannot see the pisiform. So that will piss you off, I know. Then is the distal row that you can see. This is trapezium, trapezoid, capitate, and hamate. So in the posterior view, trapezium, trapezoid, capitate, and hamate. So distal is okay, but the proximal is the one that is problematic. Then is you have the metacarpal. So there is this 5 of them, as I said before. This area that articulates with the carpal bones, these are called the base. Then this area is the body, and this is the head that articulates with the phalanges. And the phalanges, most of them have 3 parts, so proximal, middle, and distal, but the thumb does not have those 3 parts there, so it is the proximal and distal. You can also see these sesamoid bones. Sesamoid bones are because of the frictions if you're using your hands a lot, that these bones will develop. Physically, if you're using your hands a lot, there's a lot of physical friction. Then these bones will develop in the membranous part of the tissue. So now is the lower part of the body. So this is the pelvic girdle, or also hip girdle. For the appendicular bones, these are called the hip bones. Another name is called coxa or coxae, coxal bones or coxae, same thing. The E at the end is plural form of coxa. So there is made of three different bones. Superiorly, that is ilium. Anteriorly, that is the pubis, and posteriorly and inferiorly, this is ischium or ischium. So both pronunciation is okay, ischium or ischium. So these are hip bones all together. Posteriorly, they articulate with the sacrum, and this is the sacroiliac joint. This is the sacroiliac joint. This is the top of the sacrum, so this is the base of the sacrum, and this is the tip of the sacrum. This is coccyx. This sacrum, if you remember it, this is part of the axial skeleton. Okay, so this is where axial skeleton articulates with appendicular skeleton in the lower part of the body. And another one is here, the pubic bones, the two pubic bones, one from each side, they articulate in the middle, and that is called the pubic symphysis. Below that, this area, this is called the pubic arch. Also, you have this area, this is the obturator foramen. It's not written here, but I will show it to you again here, obturator foramen. And this area, this is called acetabulum. Acetabulum, this is the one that the head of the femur. This is the femur. This is the bone in the thigh. So that bone articulates here. The head of it articulates here. Also, these are some bony projection. These are called spine. So there's 4 of them. You can see 2 of them here on this view. So this is anterior superior, and this is anterior inferior iliac spines. Anterior superior, anterior inferior iliac spines. The other 2 is located posteriorly, so you cannot see it. Also, this area that you see, this is called the pelvic brim. This area is called pelvic brim. Pelvic brim. Okay, so this is the posterior view, if you can look at it. So this is the sacrum that articulates with the iliac bone. So this is the ilium, this upper part is the ilium. And it contains these spines, so posterior superior and posterior inferior iliac spines. And this upper part is called the iliac crest. Upper part is iliac crest. So if you touch your flank area, side area, below the ribs, if you go down a little bit, you can actually feel these bones. Also this area that you see, this is a notch. So again, notch is like a depression, but it is more acute. This is one notch here, and there's another notch here, and they are separated from each other by the ischial spine. So a notch also is like a half moon or half circle shape kind of structure. Okay, so now this is the lateral view of the hip bone. How do I know this is lateral view? Because of the acetabulum. Acetabulum is located laterally. So again, let's talk about the 3 different bones. So this area, area above this is the ilium. Ilium contains iliac crest. This is where you can feel it. Okay, and below the ribs, also they have a spine. So there's 4 of them: anterior superior, anterior inferior iliac spines. And this is posterior superior and posterior inferior iliac spines. So there's 4 of them. You also have some lines. So these are the gluteal lines. These are the gluteal lines. So this one and this one all the way. This is where the gluteal muscles attach there. Acetabulum itself is made of all 3 different bones. So ilium, pubis and ischium together. That makes acetabulum. Acetabulum articulates with the head of the humerus. This area that you see something like this is called the lunate surface. Looks like a half moon. Okay, and this area, this is the acetabular notch. There is a ligament that passes through this area. It's called acetabular notch. So the pubis is made of the two rami. So ramus is the singular form. This is the superior ramus. This is the inferior ramus. They join together in this area, and this is called the pubic tubercle. This bony prominence, this is pubic tubercle. And the ischium is made of one ramus only. So this is the ischial ramus that articulates with the inferior ramus of the pubis. And this area is called ischial tuberosity. So this is a rough, big, bony marking, and that is where you sit. When you sit, you can actually, this area is the one that is sitting on top of any surface like a chair or a bed. And if it is something really hard, this area become painful. And this is a spine, so it's a bony projection here, and that separates the two notches. So this is the greater sciatic notch, which belongs to ilium, and this spine separates that in greater sciatic notch from the lesser sciatic notch that belongs to ischium. Okay, so ischial spine separates these two notches. And you have this obturator foramen. This is the obturator foramen. That is made by the two bones. One is the pubis, the other one is the ischium. So this is the medial view, because in the medial view you cannot see acetabulum. So this is one way to know it. So ilium is located here above this area, this ilium. So you can see again iliac crest. So no new information. Now, this is the spine, so anterior superior, anterior inferior iliac spine, posterior superior, posterior inferior iliac spine. No new information here. This is the greater sciatic notch, which is separated from lesser sciatic notch by the ischial spine. This area, the depression that you see, this is called iliac fossa, and this is where colon. This is the large intestine, cecum. Is located on the right side of the colon, that is they are sitting in that area. So these depressions are for large intestine. You see the iliac tuberosity, so it's a rough, large bony marking. This is the articular surface, and this is where it articulates with the sacrum. So this is the sacrum that you can see, and that area is around this area. Auricular surface is around this area. This is especially this area, this is called the pelvic brim. So it's made of two parts. One is the pectineal line. This is where the pectineus muscle attaches, and more posteriorly, this is called arcuate line. Okay, and these two are separating the pelvis into false pelvis. This is the false pelvis, and this is the true pelvis. So these two lines are separating the pelvis into false superiorly and true inferiorly. The pubis, you can see that the pubic tubercle, and also this is the pubic symphysis, and there's a cartilage in between, and they are attached here in the midline. This is the ramus here, so this is the ramus of the pubis, and this is the ramus of the ischium. So it's hard to see the separation, but this is area that they're connected to each other. And this area, this should be the superior pubic ramus, and this is the obturator foramen. Obturator foramen. Also, you see the falls and true pelvis that I was talking about it before, and this is the pelvic brim that separates the falls and the true pelvis. So above that is the falls, and below that this area is the true pelvis. Hard to imagine it in this image, it's easier to see it here. So this is the pelvic brim, okay? So it's located between the superior border of the pubic symphysis all the way to the sacral promontory. So if you guys remember it in the previous chapter, I talked about that. Sacral promontory is important, especially in women. If it is located more anteriorly, the head of the baby cannot come down. So it should be more distally. It should be more posteriorly, not distally, posteriorly. So above this line, this is the false pelvis. Below this line, this is the true pelvis. And the lower part of the true pelvis is here. So between the lower edge of the pubic symphysis all the way to the coccyx. And this area that you see, this is the pelvic inlet. Okay, so this is the pelvic inlet because the head of the baby is entering birth canal. Okay, so this is why it's called inlet. And this is the pelvic outlet. So this area is the outlet because the head of the baby is leaving, or the body is leaving. The body of the fetus is leaving the uterus. So this is why it's called pelvic outlet. Okay, so the pelvic outlet is located between the pubic symphysis and the coccyx. Pubic symphysis and coccyx. Also between the two ischial spines. So this is another anatomical importance here in women. So if these two ischial spines are very close to each other, then the baby cannot be delivered. So it has to be further away from each other. Also in the later part of the pregnancy, this coccyx is moved backward. So it's moving this way. In men is like this. It's more anteriorly. Normally in women is like this. It should be inferiorly, but this area become very soft in the later part of the pregnancy, so it can be moved backward. So once the baby is delivered, then this can move backward, and that's not an issue. It will not block the delivery. And also another thing is that this pubic symphysis that is there during the later part of the pregnancy becomes softer. So when the head of the baby and the body, I shouldn't say baby, the fetus is delivered, then this also stretches out. So it gives extra room for the delivery. So the bones and the lower limbs, this is called femur, and this is the only one bone on each side in the thigh. This is the longest bone in the body. So again, you have to think about what is proximal, what is distal, what is anterior, what is posterior, what is medial, what is lateral. So the head of the femur is located medially. Okay, medially, this is where acetabulum is located, so articulates with acetabulum. And also you can see fovea capitis. This is where a ligament attaches, and also blood vessels go and supply the head of the femur. And then you have the neck, and the neck area is important clinically because this is the most common area on osteoporosis to break. And then you have the trochanterics. Trochanterics are bony prominence. One is located medially, this is called lesser trochanter, and the other one is located laterally, this is called the greater trochanter. There is a connection between these two trochanters. One is called intertrochanteric line anteriorly, and intertrochanteric crest that is posteriorly. So crest is more prominent than the line. Then this is the body or the shaft or the aphysis of the femur. Posteriorly, you can see the greater gluteal tuberosity. This is where gluteal muscles attached to that. Distally, you can see these two half spherical structures. These are articular surfaces. These are called condyles. So there's two of them. One is lateral, one is medial. This is medial, this is lateral. Above that, there's a flat area. This is called patellar surface, and this is where patella is located. So femur articulates with patella in this area. Above these condyles, you have these epicondyles, so smaller bony prominence. Okay, on each side, there's some muscles attached here, ligaments. Also, you have adductor tubercle, another bony prominence, and this is adductor muscles attached here. So the distal part, it is difficult to know what is the posterior view. So this is the best way to know the posterior view. So the space between these two condyles, this is called intercondylar fossa. This is the best way to know this is the posterior view of the femur. Otherwise, it's not easy. You can recognize other structures easily, but anterior posterior view is a little bit difficult. So although you have this gluteal tuberosity and intertrochanteric crest posteriorly, but the best one to look at it is this one. So if you want to know which is anterior, which is posterior view, first look at this. Okay, so this is the intercondylar fossa. And above that is another flat area that is called popliteal fossa. This is just behind your knee, popliteal fossa. This is patella. This is a sigmoid bone. It's more or less is a triangular flat bone. This is the base and this is the tip. So here the quadriceps tendon attaches, and quadriceps tendon is muscles of the thigh that can cause extension of the knee. And in the lower part here is the patellar ligament attaches, and the patellar ligament is connecting patella with the tibia. I will show it to you later. On the medial view, you have the articular surfaces. So this is a medial articular facet, and this is the lateral articular facet. So this is more a inner view or a posterior view, and you can see the two flat articular surfaces. These two articulate with the condyle of femur. So medial condyle of femur, lateral condyle of femur. It does not articulate with tibia or fibula in the leg. Okay, it only articulates with the femur. And these are the bones of the leg. Normally, people call the whole lower limb leg, but that is not anatomically correct. Thigh is the upper part and leg is the lower part. So above the knee, that is called thigh. Below the knee is called leg. So there's two bones similar to the upper upper part of the body, upper limbs, and the forearms. You have two bones, and here you have two bones also. So the thicker bone is located medially, and that's called tibia, and the thinner one is located laterally. That's called fibula. The tibia is a big part of it is located proximally, and these are the condyles. Normally, condyles should be half spherical, and these are articular surfaces, but here they are not half spherical. You have this articular surface here, and they articulate with the condyle of femur. And in between, you have this intercondylar eminence. That is preventing movement of the condyles of femur to go side to side. So it is important for stability of the knee joint. Okay, so it prevents movement of the condyles of femur side to side. So this is the proximally, you can see these structures, medial and lateral condyle, articular surfaces, and intercondylar eminence. Anteriorly, you can see the tibial tuberosity. This is where the patellar ligament attaches here, from patella, coming from patella. And then this area, this sharp area that you see, this is the anterior border. Okay. And then distally tibia is has this structure. So this is called medial malleolus. If you touch your ankle area, there is some bony prominence on the medial side. There is one, and that's a medial malleolus that belongs to tibia. There is also an articular surface here. This is an articular surface, and that articulates with the talus, which I will show you in a minute. Then is the fibula. So this is the head of the fibula proximal that articulates with the lateral condyle of the tibia, and that makes it the proximal tibiofibular joint. It shows here a superior. Superior is wrong because somebody can lie down and that joint is still there. So this is a proximal, closer to the body, tibiofibular joint. And then this is the body or the diaphysis or shaft of the fibula. Not much structures are there. There's not see anything important there. And distally you can see the lateral malleolus. Again, if you touch your ankle on the lateral area, you see a bony prominence, and that's the lateral malleolus, and they articulate here again, and that makes it the distal tibiofibular joint, not inferior. Distal tibiofibular joint, same idea here. Okay. Oh, by the way, these two bones are connected with each other by the interosseous membrane, which is a dense regular connective tissue. Then is the foot. So you can see there is 3 different parts there. So this area, that is the ankle area, this is called tarsal bones. This is the metatarsal bones, and these are the phalanges. So there is 7 tarsal bones, not 8, 7. And you have the 5 metatarsal and 14 phalanges. So this one that's located superiorly, this is called the talus, and that articulates with tibia and also partially with the fibula. Below that, this is calcaneus. This is the heel of the foot. Anterior to that, you have the cuboid, but cuboid is located laterally, and you have these bones that are located medially. So navicular articulates with thallus, and then anterior to navicular, you have these 3 bones. These are called the cuneiform bones. So this is medial, that's intermediate, and that's lateral. Lateral articulates with cuboid also. And then the cuboid and cuneiform articulate with metatarsal bones. There is this 5 of them are there. So then you have the phalanges, which is most of them have 3 parts, so proximal, middle, and distal, except the big toe, which is called helix, and that has only proximal and distal phalanx. And this is the side view, so nothing new in this view. You can see the talus superiorly, calcaneus inferiorly, navicular anterior to the thallus, and cuneiform anterior to the navicular bone, and then you have the metatarsal all the way here, and the phalanges all the way there, and most anterior. You also see this one is not labeled, and that is the cuboid, if you want to write it down. You also have 2 arches there, anterior posterior arches called longitudinal arch, and the transverse one, side to side, is these are called the transverse one, from medial to lateral. There is also the difference between a male and female skeleton. There is importance in the skull, but the difference is not that big. I think the one that is in the pelvis is more important and easier to view than the skull one, so that's why I put this image here. So in male, overall, the pelvis is taller and the bony prominence is rougher, and it's more prominent. Compared with female, that the bony prominence is less prominent, and it is broader, less tall than men. So the ilium and the iliac crest that you see is higher in men than women. So if you see this area, the base of the um, sacrum and the sacroiliac joint, so the iliac crest is higher in men than women. Also, the iliac fossa is deeper in women and shallower I mean deeper in men and shallower in women. The sacrum is narrower in men, and also the angle is more pronounced because of the coccyx. Coccyx is located more anteriorly in men, but in women it is broader. The sacrum is broader, and the angle is less acute because the coccyx is located more inferiorly. So that's because of the coccyx, the angle is a little bit wider, and here the angle is a little bit sharper. Or the curvature, does not matter, same idea. Also, the pelvic inlet and outlet is narrower in men and wider in women. So here you can see that this is circular in shape, and here in men it is heart shape. So both the inlet and the outlet, this is inlet, this is outlet, they are both wider in women than men. Why? Because of the delivery of the fetus. You can see the acetabulum that is located laterally, but in women it's located slightly anteriorly. You also see the obturator foramen that is more oval shaped because this pubic angle is narrow, and in women it is more triangular in shape because the pubic angle is very wide. There is also differentiation changes happens during the age. One is the bony matrix. As you age, the osteoblast activity decrease, and because of that, there is an increased risk of osteoporosis. And the reason for that is decrease in the level of sex hormones in both men and women. It roughly starts around age 35, and it's a lot more in women than men. So about 1/3 of women and 1/5 of men will have osteoporosis by age 60, 65. Bony markings also decrease by age because of the decreased activity, and when the activity decrease, the muscle strength decrease, and the pull on the muscle decrease, the pull on the bones decrease from the muscles, and the muscle mass decrease. So this is why the bony marking is less prominent as you age. Fontanelles that are opening in the skull usually closes by age 2, and the importance of the fontanelle, if you remember it, is to allow development of brain. Teeth usually starts growing by age 6 months. Those are the primary teeth. Most of them will fall by age 6, and then you develop secondary teeth, and by age 12 you should have most of your secondary teeth. And again, this age ranges, it's not that exact science. It varies from one child to another child. The wisdom teeth usually grows later and during the puberty. But later on, due to osteoporosis, and also it could be due to diseases of the gum, that the patient may lose their teeth. So by age 60, the teeth start falling. The curvature of the vertebrae, there's two curvatures. One is the primary and the other one is the secondary. The primary ones are the one that you're born with. One is in the thoracic area, the other one is in the pelvic area, and that developed during 3 months to age 10. That is because of the weight of the head on the cervical area, so these are the secondary curvatures that are developing, and in the lumbar area, that is a secondary curvature. That is because of the weight of the thoracic cavity, head, neck, and the upper limbs. So those two curvatures develop as the child starts sitting and walking. So those curvatures develop. The thoracic and the sacral ones that are the primary ones, usually there are some curvatures there, and with age, those curvatures may increase. But you should have the curvatures initially at the time of birth also. The intervertebral discs shrink because of the fluid that is inside those discs decrease, and the proteins will clamp, so that's why the height of the person also decrease with age. There's changes in the epiphyseal growth plate, so starting with age 3, some of them will close. By the late puberty, these growth plates will fuse and ossify, and that's why the increase in height will also stop. That varies from from a girl to a boy. So usually the girls, because of the estrogen and progesterone effects, the fusion happens faster than the boys. And epiphysis of the pectoral and pelvic girdles also close. That happens in the mid-teens and mid-20s. So it varies again from one person to another person. And if you have any question, please let me know. Thank you.